Hello, I'm Sharon with Nurse Tim, and I'd like to thank you for joining us for our webinar, Test Item Writing the Easy Way, featuring Karen Sherrill and Virginia Ginny Wangaren. We will have technical assistance available at 866-861-2896, option 1, or help at nursetim.com. Handouts are available to download for our live viewers in your login email and for archive viewers on the right side of your screen. Please note, handouts are for personal use only and are not to be distributed to others. On the Zoom toolbar, you'll find the Q&A pod usable by our live attendees. At the end of our webinar, we look forward to a discussion with your questions in the Q&A pod. Our archive listeners are encouraged to drop us an email or give us a call. We also value your input as to desired topics for future webinars. ANCC disclosures. NCPD. This webinar has been awarded one Nursing Continuing Professional Development Contact Hour by Nurse Tim Incorporated. Nurse Tim Inc. is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. Successful completion. Criteria for judging successful completion of the webinar are attendance at the entire activity and submission of a completed evaluation. Expiration date. Archived activities must be completed and evaluations submitted within 30 days of accessing from the Nurse Tim Inc. website. For more information, contact help at nursetim.com. Learning outcomes. 1. Identify principles essential to the construction of multiple choice test items. 2. Discuss item revision to increase the complexity of questions. 3. Apply shortcuts to write high-level items quickly. Throughout this activity, the speakers may use a variety of real and varied resources from health education vendors. They are for illustrative purposes and are not to endorse any product. All images and references to the NCSBN Next Generation NCLEX are the property of the National Council State Boards of Nursing and provided for teaching purposes only. And now I am so pleased to introduce our speakers. Karen Sherrill is an experienced nurse educator with over 3 decades of teaching in associate degree and baccalaureate nursing programs. Her experiences, passions, and areas of expertise are broad. They include clinical judgment integration, Next-Gen NCLEX item development, active and scrambled classrooms, student success and remediation, pre-licensure testing, and simulation pedagogy. Karen has led several innovative projects in college, statewide, and national organizations to advance teaching and learning in nursing education. Karen enjoys serving on the board of directors for Haiti Kids School, which supports children's education in Leogane, Haiti. In her retirement, she enjoys traveling internationally and getting out of the hot Phoenix weather and escaping to the mountains of Montana. Dr. Virginia Ginny Wangaren is an educator, consultant, and speaker with nearly 40 years' experience in nursing. She has taught at the ADN, BSN, and graduate level, and currently is Assistant Clinical Professor of Nursing at Iowa State University. Dr. Wangaren is recognized as a lifelong leader and nursing advocate, serving on numerous committees and boards, advocating for the profession and at-risk populations. She was most recently honored as one of Iowa's 100 Great Nurses for 2020. She has developed and implemented concurrent enrollment programs and concept-based curriculum. Dr. Wangaren is a consultant and speaker for accreditation, curriculum development, learning strategies, and outcomes assessment. We're so thrilled to have you both with us today, Karen and Ginny.
Thank you so much. Karen and I are really delighted to have the opportunity to do this webinar with you. And if you're with us in the live audience today, or if you're part of the archive audience watching in the future, we hope that you'll find this webinar very helpful. By the end of the hour, we're hoping that you will find writing and revising test questions to be less onerous and something that you can actually look forward to, maybe even find as a welcome challenge. So let's begin by considering, where do we start? So first, we want to look at creating items for an exam by starting with the course objectives or the competencies, the student learning outcomes, whatever language you use to determine what students should demonstrate in terms of the knowledge, the skills, the attitude of a nurse. The best way to organize this is by having a blueprint where you map out the kinds of questions you're going to ask and when you're going to ask them and how many. The blueprint makes us accountable as we strive for a valid and reliable exam. The webinar that we finished earlier today is on test policies and blueprints, and I would encourage you to watch it if you weren't able to attend the live session. Now, another excellent resource for determining our item content is the NCLEX test plan. The detailed test plan is a wealth of information for nurse educators and for faculty really teaching at all levels. Use that to help inform what that beginning nurse needs to know and to help balance your test questions across the NCLEX test plan. We also highly recommend using the most recent National Council State Boards of Nursing practice analysis. That's the evidence-based research that's used to support exam updates and validity. In fact, one of my favorite ways of finding revising new test questions is through clinical experiences. One thing that we want to remember is that the NCLEX is based on what the new nurse generalist will do, especially during those first 9 to 12 months of practice. When we watch students and even novice nurses in the clinical setting, we can pick up on those situations that maybe cause them to pause, perhaps maybe asking for help or contemplating decisions. So we observe those scenarios that lead to clinical judgment and clinical critical thinking and decision making. And that's what our graduates are going to have to demonstrate when they become nurses. So I always encourage faculty to sit down with your favorite beverage at the end of a clinical day or clinical night sometimes and spend about maybe 15 minutes just jotting down some of the situations that you encountered or observed in clinical that week. I mean, usually 2-3 sentences is really all you need to sort of document that into your mind and to have it there for reference. What were some of the misconceptions that students had or the areas where they struggled to respond with the appropriate nursing actions? Or how did they process decision making? What was that thinking out loud that you were asking them to do? Perhaps they had an error or a near miss, or you observed somebody else nearly doing that indicated a need for more learning and a greater understanding. By bringing these realistic scenarios from clinical or even from class discussions, simulations, etc., it really helps to add realism, to make your tests more applicable, and it's more meaningful to the students. So we're doing that, we're giving accurate evaluation data. And finally, we also look at the outcomes of our standardized exams. Standardized exams are an excellent tool to get a snapshot of how students in our program are doing against the national standards. We take those snapshots and we look for the strengths and the weaknesses that we can modify. The questions that were missed on a standard exam, we may want to do some reinforcement and then ask a similar question on a unit or semester exam to see if indeed we have improved the learning on that topic. The one thing to keep in mind is that the NCLEX exam does not test a student's knowledge. It tests a nurse's thinking. Understanding this is so important. When you look at NCLEX style questions, these are situated where the nurse is with a client or a patient and following the nursing process and demonstrating clinical judgment. They're embedded in the world of the nurse, and that's the goal that we need to work towards. We use Bloom's taxonomy to help us think about the level of difficulty and the taxonomy for our questions. So at Nurse Tim, we like to break this down into kind of a more manageable process, we think. So understanding that the questions that come in have that knowledge and comprehension level. That's the earliest one that we have. So these are typically very specific location in the book. These are questions that we want to limit in exams. In fact, as we go further into the curriculum, these lowest level questions should disappear completely. Our next level that is what we're really aiming for, questions that are at the application and analysis level. Right up there, we can see that students are taking information from different parts of their assessment and their knowledge base and putting it together to make a decision. They're applying that information. They're analyzing the data they get. These are the level of questions that assess outcomes and competencies. Now, importantly, these are questions that are focused on the nurse's actions, the application of nursing process and of clinical judgment. And in fact, the questions that they will see in the licensure exam will include specific assessment of the graduate's ability to apply clinical judgment. And in the clinical judgment measurement model, we see realistic patient scenarios or case studies. So that's really going to bring students up to that higher level, putting it all together, of evaluating. And we often bring that into class, lab, clinical, through that creating aspect of the student learning process. So these are all so important. Karen's going to expand on these items in the fourth webinar of the series when she talks about Next Gen Cases Made Easy. So in this webinar session, we're going to focus on differentiating between low-level questions and high-level items. And then we're going to talk about ways to write or modify questions that are going to give you tools to use immediately. So let's start by looking at what it means to be a low-level item. So this would be at that bottom of Bloom's taxonomy, that knowledge and comprehension. So remember, this is going to be recalling facts with some very specific information. These are those things that can be memorized. And in fact, there are things that have to be memorized. We're not denying that. But now there are certain pieces of information that students need to memorize, and we can check that through retrieval in the classroom, through those quizzes we do in class, and so forth. We will assess that in exams by giving them questions that are at a higher level of difficulty, but require that they bring forth that knowledge, that they remember those facts, and then can apply those facts to a specific scenario. They're going to learn it and use it frequently. Now, I like to use these low-level items, as I said, as kind of a quick check-in quiz, maybe when they come to class, or just right before we do an activity where they go in and we do a little bit of fact-checking, some quick questions in class, and then I put them out into a group, and they work on a case study, or they do some other activity, which makes them create and apply this information. And that will help prepare them for the higher level questions in our exams, as well as in the National Council's exam when they get to that point. So in the very first semester, we may be using some of these in some key information pieces to make sure students are retaining that most critical stuff. But we want to move very quickly from knowledge to comprehension, and then further up the taxonomy. Now, let's look at these high-level questions. We want them to be, at the very least, able to apply and provide rationale, and then eventually to apply and analyze. So when we get to this level, we're assessing to see that the students can demonstrate understanding of the information and that they know how to use that information. That's the key. Do they know what to do and why? For instance, one of my favorite approaches when looking at this level of question is that the student is going to have to decide, do I have enough information to do something for this patient? If I don't have enough information, what do I need to do? If I do have enough information, what am I going to do? These decision points and these actions are the foundation to clinical judgment. Think of it as you would, think of that as you write questions. What information do they have, and what are they going to do about it? So your questions need to be action-oriented. We want more and more of these high-level items as we go through the curriculum. So how do we identify low-level items from high-level items? Well, you can typically find the answer or the rationale of a low-level question on the page in a textbook. You can say, well, it's right there on page 692 in the left column, third paragraph. When it's defined in the book or listed in the book, when it's very clear in the book, it's a low-level item. Again, it measures the student's knowledge, but not necessarily the concept or the competency, especially not their understanding and application of that concept or competency. So very often these low-level items are going to be focused on diseases or lab values or something very simple about the procedure, about anatomy or physiology, or maybe what it's not doing is it's not interpreting or applying that to perform a nursing action. So now let's look at what a high-level item means. When you're looking at that high level, it means that the nurse is making a decision about the care of a patient. So it's action-oriented. The nurse is performing an action. Very often with these questions, we create a scenario. We want that image in the learner's mind. So we give them a task or a decision to make or a challenge to figure out. And we want to know, what will they do? How will they prioritize? These are the kinds of things that we're looking for in the high-level items. So remember, low level tends to be those facts, those textbook type things. The high-level items are based on a nursing action. Okay, so now let's take a look at how this might work. Is this a high or low-level question? Which complication most commonly occurs during the first 24 hours after a percutaneous liver biopsy? Well, the correct answer, as you can see, is number 2, hemorrhage. Now, this would come straight from the book, Complications of Liver Biopsy. So let's look at revising this question. Okay, now, the STEM says that the nurse understands that hemorrhage is a complication of liver biopsy due to what reasons? Now we're looking for some understanding, right? That they get the reasoning behind this. So we've moved more into comprehension. Okay, so the student knows that's a complication, but why? That's the first step. And of course, the liver is rich in arterial and venous blood, so that makes number 1 the correct answer. So we've made this question a little bit higher, but we can really do better. Okay, so now the nurse recovers a client after undergoing a percutaneous liver biopsy. What findings are most concerning? As you can see, it is the elevated pulse with the lowered blood pressure and the still normal respirations. But what's important here is that the student needs to understand that these are early signs of hemorrhaging and know that those would be the most alarming. Interestingly now, when you're looking at this question, you see that the distractors, the incorrect answers, are not illogical. They're not necessarily even unusual findings for this particular client. The student now must differentiate things that they might expect to see from what would be an unexpected or an indication of concern or a complication. And it's based on their understanding of the procedure. So this is a higher level thinking that's required to answer this question. However, we can do this at an even higher level. So the nurse is caring for a client after a percutaneous liver biopsy. Notice, same client. We're starting at the same. It's what we do after that makes a difference. The nurse is caring for a client. The assessment findings include a heart rate at 112, blood pressure 96/54, respirations 22. The client is lethargic. What action should the nurse take first? Now we have moved up to analysis. The student is looking at a variety of data and they're having to put it together to understand what's happening with the patient and what should they do about it. Now in this case, you're going to see that there are several correct answers in that these are probably going to happen. But the most correct answer is to apply oxygen at 2 liters per nasal cannula because this client is probably hemorrhaging, so they're going to be hypoxic. And the fastest, quickest action that we can do is get that oxygen on. Then we would probably lower the head of the bed. It's very possible that the client's going to be getting some red blood cells, but that's going to come later. And applying oxygen is a more immediate and more impactful action. Of course, applying pressure to the biopsy site in this particular case is not going to be a good choice because the biopsy site is not superficial to the surface. So that helps to differentiate the student who knows about percutaneous liver biopsy, from the student who has really no clue of what's going on. So this makes it a very discerning question and certainly higher on Bloom's taxonomy. And most importantly, this is more like the questions that students are going to encounter on the licensure exam, and so it helps to prepare them. Now, we'd like to ask a question of you. If you're in our archive audience, you can pause and maybe even talk this over with a colleague if you're watching together. If you're in our live audience, we'd love you to answer this question. What % of your exam is a prioritized or analysis level item? So I'm going to give you a few seconds to get that answer. As the answers are coming in, okay, I think we can go ahead and look at the results now. So that's interesting. About a quarter of you indicated that you really don't have very many of these items in your exam. So the most frequent response was C, 26 to 50. But interestingly enough, these were pretty well dispersed. So we have a lot of variation out there. And honestly, that's not unlike what we saw in our research when we did that just a few years ago, and what we're seeing in the more current literature too, about faculty's preparedness for writing, delivering, and analyzing these kinds of questions. So we're really glad that you're here, because we're hoping that these webinars in this series will be helpful and help you to address those. So let's go ahead and close the poll now, and then I'm going to move on to thinking about, remember that high-level questions are nursing practice centered. So when we add the nursing process, we start to move it up to a higher level. So that's one way that we can start moving these from that low level to that higher level. We also know that assessment and implementation are two of the activities that we do most frequently when we're actually in the practice setting. So we're going to want those steps well represented in the blueprint. So we'll probably do a little more assessment, a little more implementation, and a little less maybe nursing diagnosis or problem identification, and a little less of evaluation. And then we also want to keep in mind that those very common misconceptions that students might have, put those in the distractors so that we can identify students who truly didn't understand from those who simply didn't make the best decision or read it correctly or make the best decision. Another fairly easy way to increase the level of difficulty is to put two concepts into that question. For instance, you might be talking about diabetes, but bring in renal failure, either acute or chronic, or if your question was an assessment question, rephrase it a little bit and bring in a couple of interventions. Then the student has to think a little bit more about the process that I shared earlier. Do I have enough information so that I can do something for my patient right now that will help? If I do, what would that be? What intervention will I choose? But if I don't have enough assessment, what do I need to know to make the best nursing action? So when we work with them on these types of higher level questions throughout the curriculum, classroom activities, lab, sim, clinical, you name it, and then we build that kind of thinking process into our activities and our test questions, we're really helping them to prepare for practice, which then means they will also be prepared for the exam. So these are some of the strategies that you can use with questions that you already have, or questions that you're inheriting and that you want to revise and make better. Now I'd like to invite my colleague Karen to step in, and she's going to talk to you about what questions look like. And she's got some great strategies for writing and revising questions. Welcome, Karen.
Thank you, Jenny. I have so much enjoyed your listening to you. Who I actually was kind of leaned back in my chair, and all of a sudden I'm like, oh my goodness, I'm up here in just a few slides. I need to pay attention. So, I wanted to dovetail off this particular slide that you just shared with the audience, because, one of the things that oftentimes I think we forget to think about within our classroom as we're guiding and instructing our students is that we oftentimes teach our content in a silo, in isolation. Oftentimes our students will get their GI content for these 2 weeks and then GI's done. Let's move on to renal disorders. And we'll do renal for a week and a half, and then we'll put that one away and we'll pack it up and we'll move on to endocrine disorders. The challenge with that is that students don't learn how to combine and mix different disease processes and concepts in order to appropriately prioritize. When we think about the NCLEX exam, in this particular country, you can be a nurse right now at 60 questions on the NCLEX RN exam and the PN exam for that matter. What that means is that currently there are 60 items plus 15 pilot items, which of course does not score against the student. And when we migrate to next gen in just a short few months, we're going to have a minimum of 70 questions. You can be a nurse in 70 questions plus your 15 pilot. So the thing is how does National Council do that? And this right here on this slide gives a great example. We've got a nurse caring for a teenager, there's my pediatric content, who's insulin dependent, there's my med-surg content, and 32 weeks pregnant, there's my OB content. So I think this is a great example of how it is we need to think about better challenging our students and how to not only be tested on multi-system, but more importantly, let's teach them in multi-system. So I kind of got off on a little rampage there. But now I'm going to move on with my presentation. So as we look at a multiple choice question, there are several different components to it. And this is probably not anything that is new to you, but if you are a new educator, and we love our new educators, we support you in every way possible to become an expert educator. We know that transition is such a difficult one. The components of a multiple choice question includes the STEM. STEM is going to identify the primary problem, should reflect on the nursing process. We have our options, and the options, of course, the different answer choices. We need to make sure that they're pretty similar in length. We need to make sure there's no grammar errors within that. We need to make sure each of the distractors or the incorrect answer choices are realistic and that they can't quickly be eliminated from a student's mind as an incorrect answer. As soon as a student has 4 answer options and quickly eliminates B and quickly eliminates C, now it turns into a 50-50 question. They simply could do a coin toss to determine what the correct answer is. So it's important for us to make sure we're creating realistic distractors for our test items, making sure that they're plausible. We also want to have the correct answer, and that correct answer needs to be clearly correct, and we need to support that with our rationale. And rationale should not only explain why the right answer is right, but it should also explain why the wrong answers are not as right. The high-level items may have 4 correct answers. Then we need to strategize on our highest priority for our rationale. I think faculty, many times you'll get 4 correct answers and the student has to choose the priority or the highest level concern, and those are very challenging for us to defend. So because we can't turn to a page of the book, as Ginny had already pointed out, if we're turning to the page of a book, we've got a low-level item. So what we need to provide to our students at that point is various strategies of prioritization. How does that student determine the highest priority answer? Is by applying a strategy for prioritization. So let's enter now our polling question number 2, and this is a select all that apply multiple choice question. I want you to select all the different rules of prioritization. Which of these do you feel are appropriate strategies of prioritization we can provide to our students? So those that are watching us live, go ahead and click on the best answers here for the select all that apply. Those via archive, I want you to do a mental check as you read through these different answers. Think about how you would, in fact, select the answers for this question. So I'll give you just a second to do that. There are several of them. And of course, for select all, it is called a yes, no, or a true false. I'll give you just a second for that. Okay, Sharon, if it looks like people have voted, wrap that up and see where we're at. And this is a trick question, guys. I pulled a fast one on you. The reality is these are all strategies of prioritization. So each of these are validation that we can prove and show to our students a reason why the best answer is the best answer. And we are not addressing each of these specifically within this webinar, but I encourage you to reach out to us if you have further questions or watch some of our additional webinars that can offer some of this material. So what if we want to write a question from scratch? And I'll be honest with you, this is probably the least preferred way in which to write a test item. Many times people don't tackle this process till they've been an educator for a few years because it is certainly the most challenging. But I want to walk you through these harder steps first. And then as we go through the rest of this hour, you're going to see some ideas and some shortcuts that are going to streamline your process significantly. But let's start with the hardest first. So what do we want to do? And as Ginny has identified, of course, we've gone through we've gone through the steps of retrieving our learning objectives, our outcomes. What do we want to measure? We need to identify the content we're going to be testing. We will have reviewed our test blueprint that shares with us just exactly what we want to be tackling within this test item. Every test item needs to relate to one of your course objectives. If you are testing material that is not a part of your course objective and not being taught in your classroom, that's considered an unfair test item, and that's certainly grievable by students. So always be sure that your test items correlate to the outcomes of your course. When you think about this process for a test item you're going to generate, think about what you want the nurse to do, okay? Not what you want the student to understand, not what you want the student to retrieve, but think about what you want the nurse to do. When I write these brand new items from scratch, I literally will close my eyes and envision myself walking into a patient's room. That's how you want to formulate your test item. Have your students standing at the bedside of a patient so they feel like they're delivering care. You're going to create the correct option along with the effective distractors, and we're going to provide that supporting rationale, rules of prioritization. So walking through this first step, what is my student outcome? So I've got a course outcome that says utilize elements of technology and information management to deliver safe patient care. And many times this is a challenging student learning outcome because technology is not really an area that I lecture to. It's not an area that I have in my course. It's more of a threaded theme throughout many of my learning activities. But this particular unit competency has me discussing the use of patient confidentiality with the use of an electronic health record. So I'm going to think of these two content areas. I'm thinking about what's going on in my competencies and how I measure that, and what does patient confidentiality look like related to patient care. I don't want them to name the name of a piece of technology. I want them to think about how this integrates into patient care. So I've looked at my STEM or thought about the STEM or the behavior of what I want the nurse to decide. And I want them to think about computerized documentation. I want them to think about HIPAA compliance. Those are the foundational pieces of understanding that someone's going to need in order to answer this question. So a sample question would be, the nurse walks past a computer workstation in the hallway that is logged into an active client record showing the screen. No healthcare worker is around. What should the nurse do next? Okay, so this item will integrate that student's understanding of computerized documentation and also their understanding of HIPAA compliance. They'll need that understanding in order to answer this question. Now I'm going to construct my answers and distractors. And those are the 4 choices that I've come up with the correct answer being, of course, log out of the system and close the patient record. That would be the safest option of those 4 that are identified. But again, those other 3 options there's nothing there where you could say, wow, I'm just going to forget that one. That's just a ridiculous answer choice. These are all possibilities. And in fact, many of these are things that students may have seen in clinical. They might have seen nurses perform these incorrect choices. So they are very viable options. They're plausible distractors for sure. And of course, I want to put in my rationale. I've summarized a section of the textbook to support HIPAA, to support technology, to support electronic health records, whatever that section of the book is. But I also want students to identify that process of prioritization. And in this case, I identified fast versus slow because it's pretty quick to click out of that computer, to log out that EHR rather than go up and down the hallway and look to the nurse who was documenting and ask them to do it. So it's an example of that. So those are the 4 basic ideas if you're starting with a blank sheet of paper. But now let's also think about, as we're writing those test items, that we need to create something that is very fair. And we need to make sure especially that these items are fair to students that lack English proficiency. I don't know about you, but I can tell you that the numbers of students lacking English proficiency has increased significantly in my classroom over the last decade or so. And I'm not speaking about English as a second language, but I'm also thinking about reading comprehension. I know the school that I've taught at for years, Inner City School, comes from the underserved K-12 population. Reading comprehension is a challenge. So we need to make sure we're constructing these exam items that are in a language that is understandable to all students, whether it's primary English language or whether English is a second language or more. So here are some examples. Client is experiencing a bout of pneumonia. Using about is kind of improper English. It's common talk in some parts of the country, but it could be confusing for students that are not used to that slang or that language. Nurse requests coagulation studies. This one confused a group of my students a few years ago who actually had some research background, and they were confused as to why you were studying coagulation because they thought of an actual research study when they read this question. How about a food example of submarine sandwich and a tossed salad? Submarine sandwiches is very dependent upon the type of the country, where in the country you're at. You know, submarine sandwiches could be hoagies, can be po' boys. There's just a lot of different names for them. So you could use something generic such as a meat sandwich to better cover that. And then of course a tossed salad. You know, if you're not familiar with English language, a tossed salad means that somebody threw it. Why would somebody throw their salad somewhere? It just doesn't make sense to someone who hasn't heard that term before. How about the client's running late for an appointment? And a student may get hung up on the fact that a client is running. Why is this client running? That can certainly impact vital signs and admission assessments. So we need to be very clear in how it is that we're wording things within items. We also want to be cautious about cultural bias. You know, a lot of times we can have implied bias simply in the way in which we're wording things. So for example, if I've got a name listed, and of course names should not be a part of test items, but that can certainly integrate ethnicity or some bias related to age. I need to be cautious if I am actually addressing any kind of cultural disparities, or I need to make sure that I am not typesetting people. One that I've seen for years is I have a client who's a Hispanic and suddenly their diet is rice and beans. And the reality is not all Hispanics eat rice and beans. So we are stereotyping people with implicit bias simply in the way in which we're wording our items. One of my huge pet peeves is when I see in a test item, the client complains of, and I know we've said this in practice for years, but the reality is when we say a client complains of pain or the client complains of a headache, complaint is a negative connotation, and it immediately dismisses their thoughts and their concerns. So reword those questions to say a client is experiencing pain or a client is experiencing a headache, and get the word complaint out of there, because again, I think that frowns poorly upon our profession and the way in which we interrelate with our patients. So polling question number 3, tell me what you think about using publisher test bank questions. And Sharon, I'll have you pull that quizzing up and see what we've got. So I'll give those that are watching live a second to go ahead and cling in to chime in on this. How do you feel about using publishers test banks? Okay, if we've had responses, Sharon, we can go ahead and take a look at those that outcome. Good starting place is the majority. We've got 82% of the audience is saying it's a good starting place. Excellent. And 3% that use it all the time. Okay. So here's the thing with test banks, and I know I've heard Ginny say that before, but test banks know that they are compromised, and whether they come straight from a publishing company, whether you download them off the web, wherever you're getting your items from, know that they are 100% compromised. So the reality is that taking a publishing test bank question, putting those onto your exam, chances are you are going to have skewed results because it's highly likely your students have already had access to those. So words of warning. But what can we do is use it as a starting point. So if I take a test bank item, and this one talks about a client scheduled for heart surgery, which statement by the client requires the nurse to take action? Well, first of all, this is phrased as a higher level item. I see that because you know, it's the nurse's bedside. This is not something from a textbook. But what I can do is I can tweak and adjust that, and I can now have a client scheduled for an appendectomy, and which statement made by the client requires the nurse to take action. So you can see how I've adjusted this item slightly so that it's different. Now I'd encourage you to also adjust the answer choices to make those different as well, in order to not have an identical item coming from a test bank and being placed onto your exam. So here's another one. Nurse cares for a client scheduled for heart surgery. Which statement made by the client requires that this is the same one? Sorry, I don't think my slides changed. Here we go. Okay, nurse delegates the task of taking vital signs to a UAP. What instruction should the nurse give? If I revise that item, I come up with the nurse in a pre-op care unit delegates the task of taking vital signs. So I've changed up that question a little bit. Know that these are examples of things you can do, but again, they're not 100% foolproof. So you need to be very conscientious to make adjustments in both your item itself as well as your answer choices. What are some format cleanup changes that we need to consider? Each item needs to end with a question mark, and this is not true for next-gen style items. We want to make sure we're using present tense throughout the exam, using should rather than would, making sure that that present tense is fed throughout. When we use NCLEX verbiage, we also want to make sure we're using nurse and not student in our test items, parent, not mom or dad, prescription, not order, client, not patient, healthcare provider, not physician, doctor, or MD. And these are consistencies we're seeing come from National Council. So I would encourage you to use these same formats so your students can be very comfortable with what it is they're going to see on the NCLEX. We also want to eliminate which of the following. We want to make sure we're using generic names for medications only, not brand names. We want to place labels on all lab values, and vital signs should have parameters. So when you list your labs or you list your vital signs, include milliequivalents, include millimeters of mercury. Make sure that those values are in place. Get rid of any negatively worded STEM. Don't ask your students what should the nurse not do, or use all the following except. That is frowned upon. And we want to eliminate age, sex, culture, and name for a client and nurse unless it is pertinent to the question. So I've got a question here, and I want you to think about, can you fix it? How would you fix it using those guidelines we just went through? 46-year-old Hispanic male patient. Okay, well, that's not needed, first of all. recovering from surgery, has been advanced from a clear liquid diet to a full liquid diet. Client's looking forward to the diet change because he's been bored with the clear liquid diet. Well, that's not information that's necessary. I can eliminate that. And the nurse would offer which full liquid item to the client. So as I look at this question and I think about, okay, well, there's a lot of information that's not needed. And the purpose of this question is simply to identify what's clear liquid and what's full liquid. Now, I also have some, and within my correct answer and my distractors, I've got information that could show some bias. Chai tea, students may or may not know what that is and what it contains. Lime jello, jello is a brand name. Custard, custard is a term that is geographical. Some locations may call it pudding or something else. Grape popsicle, popsicle is in fact a brand name. Students may not understand that. So there's a lot of incorrectness with this particular question. But as we think about what we want that question to do, well, we really want the nurse to be able to assess whether that patient's diet can be advanced or not determine what is clear liquid and a full liquid diet. So a better option would be the nurse performs post-op assessment on a client who's been on a clear liquid diet since surgery, which findings support that the nurse should advance the diet. This is care of the patient. This is a high-level application that is really looking at a nursing decision and what that nurse should do. So here's another one. Again, we've got an extensive question with lots of erroneous pieces of information. The patient, which should be called client and not patient, 50-year-old male, not needed, eliminate that, admitted with all of these extenuating different symptoms. They go on and on for 2 sentences, and then the question is simply, okay, well, related to what? What's causing these symptoms? Well, I've told the students in the stem of the question what's happening. All they need to identify is which labs are consistent with uremic symptoms. So it really is a very low-performing, low-level item. And so how would we fix it? What could we do? Well, I want that patient to come in with some symptoms. I want students to identify, oh my gosh, look, that creatinine is high, that BUN is high. My patient has symptoms of renal failure. What additional findings am I going to be concerned about? What else am I looking for in the care of that patient? So recognizing signs of fluid volume excess in a renal failure patient is what I'm accomplishing through the rewrite of this item. Here is a question where we've got a diagnostic test that might be used to evaluate a patient with an upper GI. This is a classic type of low-level question that I frequently see faculty give. And as we know, we can turn to a page of a book. We can look at what type of diagnostic tests are associated with GI bleeding, and we can come up with the answer pretty consistently. But I want my students to know how to care for this patient before they go for this test. I want them to know how to care for this patient after the patient's return from the test. I need to put this to a higher application level. So I'm going to introduce some patient information, and my patient's now returning from the procedure, and what findings should the nurse report. So I want my students to identify what's important information, what's critical information, what's priority information. Apply clinical judgment to a patient scenario for a high-level item. After I've written a question or two, I need to let it set. I need to let it marinate for a while. I need to go back to it in a couple of days. I need to rethink whether or not it's hit the mark. Does it provide what I want it to provide? And I might also consider using it as a pilot or some trial questions. You know, if I have several different items that are very similar, I can run some pilots on them, gather some data, tweak and adjust it till it's perfected into a beautiful question that has great statistics, and I can move forward with it. So those are some things we want to think about with all of our test items. We don't want our students to fail our exam and fail our course and fail out of our program because of poor test items. We need to make sure that we are designing and writing those so it's truly measuring what it is we need it to measure. So I'm going to show you a few shortcut steps in the last We got about 10 minutes left here. It's just going to take us a couple minutes to go through these, and then Ginny and I are going to be taking questions. So I encourage you to start thinking about questions you can be putting into the Q&A, or if you'd like to start placing them in the Q&A now, you're welcome to do that. So let me give you some clues as to how to become a testing superstar. First of all, come up with a single question, and this might be something that reflects a similar format to your test item that you found out of a test bank. So nurse is getting a client out of bed for the first time after surgery. Client states, I feel dizzy. What should be the nurse's next action? But rather than just writing one question that is similar to that one, I'm going to go ahead and I'm going to write several. So I now have 4 test items that measure the same objective and learning outcome. One, I've got a client getting out of bed for the first time after surgery. The other, I've got a patient ambulating in the hallway that says they feel funny. Someone else has prolonged bed rest and they're pale and diaphoretic. Another one, the client's in the bathroom, becomes pale and sweaty. All 4 questions measure, does the student know what to do when a patient is ambulating, becomes lightheaded, dizzy, diaphoretic? What is the student going to do about that, or the nurse going to do about that? But along with these 4 items that I've just written, I'm also going to come up with a whole long list of possible correct answers and distractors. And I'm going to got my brain in the mojo to go through that falling patient in the hallway, falling when they get out of bed. I'm thinking about safety. I've got my groove on. I'm writing 4 items. Go ahead and come up with a long list of distractors at the same time. And I can take this and do a mix and match. And I can have one item that I use in a classroom activity. I can use another item on the unit exam. I can use another one on the final exam. And then I can use another one next semester that is completely different so that my students have different tests every semester. The second means of shortcut is by writing one really good question and then asking different components of the nursing process. So in this one, a client in the emergency department's been hydrated with normal saline, but they're starting to show signs of fluid volume excess. So if I want to measure their patho, I'm going to ask, how should the nurse report this finding when notifying the healthcare provider? And if I want to measure their ability to assess, I'm going to ask, what additional information should the nurse gather first? And if I want to ask a SATA or a rank order, I'm going to say select all that apply or place the steps in priority order, and I have multiple answer choices. If I want to evaluate their ability to implement, I'm going to ask what action should the nurse perform first. If I want to evaluate, I'm going to say which evaluation of the situation is most accurate. So I have kept the stem of my question, just changing, I've kept the information of my question, just changing the stem and what I'm asking, changing the answer and distractors. And of course, I can keep going here. I can also evaluate their ability to delegate by asking what action should the nurse delegate to the UAP or maybe delegate to the LPN, depending on where you're teaching in your program. So those are the down and dirty, quick and easy shortcuts. You've got those in your handout, so you can review them in more detail. I also want to remind you that what we're presenting right now is a part of a 4-test pack series. And these 3 on the screen are the other 3 webinars that we're offering today. But if you are watching via archive, I encourage you to look these up. They're all relating to the process of testing. So I want to open now to Q&A and encourage you to put your questions in the Q&A section. So Ginny and I can go ahead and start tackling those. While you're typing those into the chat, I know one thing that oftentimes I get asked is, should I have high-level items, application analysis level items, at the fundamentals level? And the answer to that is absolutely yes, you should. Students need to be exposed to these from the very first day of their nursing program. They have had extensive knowledge, understanding level items throughout their anatomy, physiology, pre-nursing courses, and it is time for them to be exposed to application analysis. But it's also very important for you to be teaching students how to take these higher level items. They need to learn how to take them before they are tested on the item. And again, that's just considered fair testing. I'm not seeing questions come in, but I'm going to let my colleague Ginny hop in and see what things you would like to, what things did I miss, Ginny?
Oh my, Karen, you did a great job. I always enjoy listening to you present because you're such an expert on creating these amazing test questions. I do see that we have a couple of questions that came up now. And yeah, I'm going to take the first one, Karen, because I'll leave the second one to you. But the question is, do you now recommend placing lab reference ranges in questions on unit exams since the next gen NCLEX is including reference ranges on all NCLEX questions? And so, Karen, chime in if you want to add to my response. But the National Council is including an EHR in the next gen case studies, and in those EHRs where there is a lab sheet, they will see the reference range. So there are times it will be there, but it will not. They are not putting reference ranges in all the traditional questions that are the bulk of the exam. So we still need our students to be familiar and have developed over time a memory of those most important lab values, and that is still in the NCLEX test plan. So I would say, no, don't put reference ranges in all of your questions, only in those that are EHR based. Karen, would you agree with that?
Yeah, I certainly would, Jenny. I think we're going to be seeing a mix as we move forward with the different item styles. But there are some basic labs your students will still need to know, and those are found within the test blueprint. So you can see in there exactly what labs it is your students have to have memorized. I was going to go ahead and I see a couple questions that I think I can answer actually together. Richard and Helen had posed questions. One was asking, why do we use the term client over the word patient? And the other one was asking about referencing a healthcare provider, and that isn't a nurse a healthcare provider, so shouldn't we use that? So this question, I'm just going to regurgitate what National Council tells us and what they have said, and much of this is within their website is where you can find the information. So as far as the term client, National Council uses the term client because they see everybody as a client. So a client could be a school. I mean, if you are a school nurse, your client is the school and the population of the school. If you are a home healthcare nurse, you see a client in their home. But if you're caring for a patient is referred to a sick person in a bed in a hospital. So National Councils recognize that client is a more universal term, and that's why they've gone to that terminology. Healthcare provider is the terminology National Council is using for anybody who is an ordering physician, nurse practitioner, a PA, anybody who can order and prescribe is considered a healthcare provider. Now, does a nurse provide healthcare? Yes, they do, but according to National Council, they don't fall in the classification of a healthcare provider. Healthcare provider needs to be that ordering physician practitioner. It's kind of like, UAP for the unlicensed assistive personnel that can contain a CNA, that can be a EMT or a tech or a PCA or whatever you call it in your neighborhood. All those terms are pretty standard, but UAP is the catch-all term for that. I see a question here from Amber. Any general recommendations for percentage of knowledge comprehension and application analysis questions for new versus senior students? So we don't have any strong evidence that tells us what we should be providing, but in my opinion, those should be coming larger percentages as the student progresses in the program. So you may start with a fairly small percentage in your new students, your fundamental students, progress to an exceptionally high number of application analysis level items by the final semester of your nursing program, keeping in mind that the NCLEX is 100% application analysis and higher. Next Gen items are higher than application analysis. So your students need to be very familiar with those and comfortable with those. So I would keep that in mind as you're making those decisions and including them within your testing policies. I'll just keep, I think maybe we have time for, I think we're kind of out of time actually. So Sharon, I am going to turn this back to you. For those people who we didn't get to their questions, I'm going to have Sharon archive those and with your emails, and I'll be able to respond to those by sending you an email to answer those questions for you. But I'm going to turn the webinar back to Sharon so we can do our evaluations and get you guys a break before our next session begins. Thank you.
Thank you very much, Karen and Jenny, for speaking today, for all of your time. And yes, and if you have further questions, please feel free to email us also at help@nursetim.com, and we will get those questions to our presenters. We're also going to invite you now to fill out an evaluation. That evaluation will produce your certificate with your contact hour on it, and it also gives you an opportunity to give us some feedback. We would love to hear what you think about our webinar and any comments, and again, any questions that you have on there, we can answer those as well. So for our live viewers, a new screen is going to appear in just a moment. Please click the Continue button to proceed to the short survey evaluation that will produce your NCPD certificate. And for our archive viewers, please click the evaluation link on the right side of your screen. So thank you to everyone for joining us today.